Most of the information and or advice on how to stage a mental health intervention could be found on this page. Some of the high points I wanted to point out is when it comes to diagnosing somebody with a mental disorder, it's best that that diagnosis not come from the family. And it's always important to remember that drug and alcohol use on any level can exacerbate mental disorder symptoms. You don't have to be a daily drug user and or alcohol drinker to make your mental disorder symptoms worse. So the goal of an interventionist or a clinician is to rule out any and all causes other than a true mental illness. And when it is determined that the mental illness is a result of no drug use, then the strategies for that intervention certainly can and will change. Now, both interventions for substance users and mental disorder clients utilize evidence-based strategies such as motivational interviewing. When you have somebody with a true mental disorder, your goals may change. For example, with a substance user, you may be able to be a little bit more firm where it's, if you don't accept this help, then these are our boundaries. With somebody that has a mental disorder absent of any alcohol and drug use, you may want to make the goal of that intervention in becoming med compliant. So when the mental disorder is the result of a complete absence of drug and alcohol use, you want to make sure that the strategies you use are non-coercive. Coercive interventions are always a last resort. You do not want to approach a person with mental disorders in a way that's going to agitate them. But remember, when your loved one was diagnosed with mental disorders, even as early as childhood, it doesn't always mean that the diagnosis is accurate. I have a lot of cases where the people have been diagnosed with a mental illness early on, it manifests over time, they turn to substances, and through traditional therapy and counseling, it's discovered that their mental disorder symptoms were a result of acting out behavior and the inability to cope with their feelings and thoughts and experiences. And with the help of 12-step facilitation and cognitive behavioral therapy and other evidence-based treatments, it's determined later on that there are no mental disorder diagnoses and or they were completely different from the original one. So our advice in staging a mental health intervention is to leave it to the professionals to make the diagnosis and leave it to the professionals to determine the approach of the intervention. Because like I said, you certainly do not want to go at this from the vantage point of strong boundaries when there's no substance use present. And always remember that drug and alcohol use will always bring about greater symptoms in a substance user. And in textbooks for clinicians, it even states, and then in this article, we quote from a textbook that whenever there is a mental disorder and there is substance use present, the clinician and or mental health professional should always determine and or consider the behavior the result of the drug or alcohol use until it can be proven otherwise.